Well, we're joined by Deepak Kumar, who joins us from Patna, also joined by Swarnim and Isha, who have very sadly lost their father of COVID-19. Deepak, let me go across to Swarnim and Isha first. Swarnim, what was the big problem in hospitalization and in finding oxygen?
So, first of all, we contacted every government hospital, including the AIMS, PMCH and all the hospitals. We found that there are no COVID bed available. We contacted many private hospitals. They were not ready to accept because they were saying that they are left with no beds. We finally found one hospital with a bed, and after a few days my father got admitted on 14th of April, but after a few days on 17th we got to know from the hospital administration that DM has instructed that only government hospitals will be getting the oxygen supplies. It is very unfair if we are not providing government hospitals, and if authorized private COVID centers are not getting enough oxygen, how will the patients will make? My father had no previous illness, any case of illness, but died due to the insufficient supply of oxygen. That was the case.
Sorry about this. I don't even know what to ask you. But what could you tell people who are watching this program? I mean, is there anything you can share, what you've learned on this experience, anything at all? I really honestly don't know what to ask you after what I heard.
I can only say it's a lack of medical infrastructure, lack of government support, that we were not able to find oxygen because the state officials are saying that don't provide oxygen to private hospitals. So what's its kind of situation like that? That if you are authorizing any center to provide to be a COVID-19 center for treatment, and then you are saying that no, there will be no oxygen, and you are saying that patients to leave. My father died only because of this, because he didn't got oxygen on time. This was the only reason.
Isha, do you want to say anything? I'm so sorry for what you've had to suffer in your lives, and I just hope that you can overcome this terrible loss. And thank you so much for your courage in speaking to us. I'm so sorry for what you've had to go through, and you are so courageous for speaking to us. Thank you. I'm going to try and get another voice in. Deepak Kumar, also joining us from Patna. He's had a very difficult experience. Deepak ji, what were some of the big problems that you had? Hospitals के problem हुए थे आपके लिए, और ऑक्सीजन का सप्लाई का प्रॉब्लम हुआ था, क्या हुआ था बताइए?
सर, ऑक्सीजन की प्रॉब्लम की सप्लाई थी सबसे पहले तो, और 6:30 बजे सुबह हमें कॉल किया गया और बताया गया कि हमारे पास सिर्फ 1 घंटे का ऑक्सीजन सप्लाई है, and we are not getting any supply of oxygen for the private hospitals from the DM office. They have called me. So we rushed to the other hospitals like AIMS and other private hospitals. And one concern about this is when the government has allowed the COVID dedicated hospitals, so they don't have even a single ventilator or beds. That was the main concern, and the hospitals was also not confused about this, because my patient, the Swarning father, was he had no anything about health issues. So only thing is the collapse of this system. They don't have even the minimum base system of oxygen supplies and all that, because you are giving a COVID pandemic dedicated hospital or dedicated bed to any private hospitals. Even a single ventilator should be there to be. So we rushed to here and there, and we lost our relative life. Nothing to say. It's a totally collapse of system.
Right, Deepak,
it's very bad. It's very bad.
It's just terrible what you've all had to go through. Thank you so much for sharing that. What we'd like to also do is give you visuals of what exactly is taking place in some of our hospitals. We are flitting from state to state. We've discussed the situation in Bihar, returning now to the situation in the national capital region and what people are having to go through in this fight to breathe in our hospitals.
मैंने हाथ जोड़ जोड़ के बेड अरेंज किए थे, जोड़ जोड़ के अपनी मम्मी के लिए रात को मैं मोदी जी से पूछना चाहती हूँ, मैं अमित शाह से पूछना चाहती हूँ, बंगाल में रैलियां कर रहे हैं वो, यहाँ क्या पेशेंट मर रहे हैं, इनको दिखाई नहीं देता।
The national capital reported its highest COVID deaths ever on Monday, 240 in 24 hours. India too witnessed its deadliest day on Tuesday with over 1,700 COVID deaths, its highest ever. But as India's COVID crisis deepens, families scramble from pillar to post for beds, oxygen and answers.
मैं LNJP से यहाँ पे रेफ़र किया था। यहाँ पे रेफ़र करने के बाद सुबह मैं यहाँ पे आया, 3 बजे मेरे पापा को एडमिशन किया। मैंने हाथ पैर जोड़ जोड़ के मैंने कहा ये मेरे परसों की बात है और है ना, कहा जाए ना मेरे पापा की डेथ हो गई है।
Suraj's younger brother did not even get a chance to say a final goodbye to his father through a video call.
एम्स गया, सफदरजंग गया, ठीक है, RML गया, भाई GTV गया, सब जगह गया, कहीं ने भर्ती नहीं किया। फिर उसके बाद यहाँ पे आके 4 घंटे में खड़ा रहा एम्बुलेंस में। एम्बुलेंस वाला कह रहा भाई जब तक भर्ती नहीं करेगा मैं यही रखूंगा एम्बुलेंस। साथ में जाके कोई एक सीनियर आया, उसने कहा चलो इनको अंदर ले जाओ, ज्यादा तबीयत खराब हो रही है। फिर अंदर ले गए। उसके बाद 3 दिन तक 4 दिन तक कोई डैशबोर्ड वाले खबर ही नहीं दे रहे कि कहाँ है पेशेंट, कहाँ पे गया है, कुछ नहीं बता रहे। सुबह से लगे पड़े, कह रहे मेरा डाटा नहीं चल रहा है, अपडेट नहीं हो रही है, एप्लीकेशन नहीं हो रही है। फिर अब जाके SDM आया तो उसने यही लिखा। फिर उसके बाद ले गया ऊपर और फिर नीचे कोई आया, उसने कहा तुम्हारे डैडी एक्सपायर हो गए रात में। और अब जाके बताया।
Not just that, at hospitals, families patiently camp outside, citing patient care problems.
यहाँ पे अंदर देखभाल के लिए अगर मानता हूँ कि अंदर पेशेंट हैगा, आप उसको जाने नहीं देते हैं, तो अंदर खाना खिलाने के लिए, टॉयलेट कराने के लिए कोई तो होना चाहिए। यहाँ पे मैं संडे के दिन सुबह करीब 6 बजे में आ गया था, सही है। 6 बजे से मैंने यहाँ पे देखा है एक भी पेशेंट ठीक होके नहीं जा रहा है। जो अंदर जा रहा है मैडम, वो मट्टी ही आ रही है, मर रहा है आदमी।
छोटे छोटे बच्चे हैं। अरविंद केजरीवाल से मैं हाथ जोड़ता हूँ कि केयर करो, कि केयर नहीं होती यहाँ पे अस्पताल के अंदर। कोई नहीं देखने वाला, यहाँ कोई नहीं है।
As India continues to fight an unprecedented medical emergency with an already overburdened staff, many grieving families continue to gasp for breath and a bed. With camera person Sushil Rathi in Delhi, Shanakshi Chakravarti for NDTV.
Well, that gives you an idea of how people are suffering in just trying to get help in hospitals. Joining us now from Lucknow as we keep travelling nationwide, Colonel Fasi Ahmed. His nephew is a COVID patient. Colonel, thank you for speaking to us. How difficult has it been for you to find medical assistance for your nephew?
Oh, it's been very harrowing. For the last 4 days, I think there's not a single contact that I've not tapped, and all the numbers that keep floating around on various groups, including the government call numbers, I have not been able to establish any contact. I happened to call up one of your Lucknow
correspondents, yes.
Kamal Khan's wife, who's also a journalist, Ruchi, and she tried to connect me. In fact, not me. She got in touch with the command center or whatever you call that, which frankly is a defunct system. There is nobody responding there. All those numbers are mere display numbers that the whole world is looking at. Otherwise, there's nothing in the form of help that is coming. People are, in fact, I'll tell you, for 2 days we've been running around, despite the fact that Ruchi was helping me get in touch. In fact, she was the conduit between us and the CMO, DM and the ACMO. But the fact is, ultimately in the night, we managed to, yesterday, in the evening, we managed to rig up our own, somebody from the family got a bed allotted in Barabanki. The hospital's name is Hind, and you see, the problem was it's a non-COVID hospital, but they admitted on condition that we bring everything, including we arrange for oxygen, we arrange for the medicines. Now, do you know, I have been arranging oxygen. The jumbo cylinder is costing 48,000 rupees. We have been able to manage 2 since yesterday. Now, this gentleman who's down, my nephew, now they are people of very humble means.
Yeah.
It is just that the family is somehow, and you see, our problem is that I myself, none of us can come out of our own houses, because we have, you see, I have just come out of COVID. My wife has been a COVID patient. We've just stepped out of it, and we are taking precautions. In fact, we've been advised not to come out. Even for our basic necessities, we are totally dependent on you can't send the servant anywhere. And these people, now how we've been able to manage, don't ask me. That's why I said it's terrible. Now, the worst thing was, I'll tell you, which should actually go on record, is that despite the government having issued orders that presumptive COVID patients to be admitted, to be registered by the command center and allotted a hospital. Now, the unfortunate part was that we got the CT scan done, and I told you this gentleman is of very humble means. Now, rigging up 7,000 rupees for him was quite an issue, but we somehow managed it in the family, and we gave it to him. After producing that result, we were told by the ACMO and that sorry, there is a systemic glitch, because the system is not accepting anything other than RT-PCR. We said, but your government has already issued instructions that for presumptive COVID patients, the CT scan would be a sufficient...
No, Colonel, I hear what you're saying entirely, and you know, this entire issue of the grounds on which people can and cannot be admitted into hospitals in a situation like this, when there are so many false negatives being thrown up, that's a huge concern. Sir. I'd like to thank you, sir, very much for being with us and expressing you know, what you have actually gone through. Thank you, sir, very much for being with us.
Thank you very much, and you also please take care. Thank you. God bless.
Thank you, sir. We will, sir.